Welcome to our tutorial on how to use TWO therapy with the extremity chamber. Before using TWO multimodality oxygen therapy, please refer to the device instructions for use. An AOTI representative should have already set up the necessary equipment. In every TWO extremity chamber therapy sessions, setting up the humidifier, the quick connect hose, and the single-use extremity chamber is necessary. If humidification is to be used, begin by twisting off the top of the sterile water vial. Open the cap of the humidifier and carefully squeeze the water into the cup. Next, press down and securely close the humidifier cap. Then plug the humidifier cable into the cup. Insert the humidifier into the extremity chamber, also known as the boot, and should be in an upright position to prevent the water from leaking out of the cap. If humidification is not going to be used, simply use the humidifier plug to close the port. Connect the quick connect hose to the extremity chamber. Locate the 2 arrow connection points on the hose in the chamber. Line up the 2 arrows at the connection point to connect hose onto the chamber and push firmly. You will hear a click when it's connected. The TWO therapy session can now begin. Slip the leg into the extremity chamber. For patients with larger limbs, those with a compression dressing around the calf just below the knee, or those wearing an uniboot, a large extremity chamber that extends above the knee is available. The cuff area must have contact directly to the skin to maintain a seal. Start by switching the oxygen concentrator on. Next, turn the controller power on by pressing the topmost button. The display will prompt you to inflate bag. Press the bottom button for yes. The ribs of the chamber will inflate. Once the bag is inflated, the display will prompt you to inflate cuff. Press the enter button again to inflate cuff. Straighten any crease and fold around the cuff by inserting fingers around the cuff area. The patient will feel slight pressure at the cuff, which is normal. After the cuff is inflated, start therapy by pressing enter button for yes once again. Therapy will start, and pressure and time will be displayed. A typical therapy session lasts 90 minutes. Within 1 to 2 minutes, the P will start cycling between 10 millibar and 50 millibar for the duration of the therapy. T indicates the number of minutes remaining in the therapy session. Once the therapy has been completed, therapy finished alarm will sound and the indicator light will flash. Turn off the controller by pressing the power button, then switch off the concentrator. Open the cuff plug to deflate the cuff. Disconnect the blue interface hose and the humidifier. Keep the humidifier and humidifier plug to reuse on the next therapy session with the same patient. You can now remove the extremity chamber and discard after use. For TWO therapy equipment setup, follow our easy video tutorial on the step-by-step TWO extremity chamber equipment assembly.